I'm a pediatrician at the Odessa Brown Children's Clinic. It's a primary care clinic with kids from mostly low-income families in the central area, South Seattle, and in South King County. And like other community clinics, we see the heavy burden of poor health, chronic diseases that are twice as frequent and more severe, more extensive dental disease, families struggling with mental health issues. We also see very clearly how our health practices within the healthcare system tend to put very tiny bandages on gaping wounds caused by social determinants. Children and their families are made sicker by the impact of toxic stress and toxic environments that erode a body's protective functions, change signaling in the brain, compromise behavioral responses to stress, plant the seeds of lifelong and life-shortening chronic disease. And like a reinforcing spiral, being sick heaps even more stress, financial worry, and unfulfilled productivity on families. And the cycle goes on. The traumatic patterns don't hit all races equally. For many non-white groups, inequity flows in generationally retrenching patterns that sap opportunity, permeate our institutions, infect our attitudes, and subtly alter our treatment of others. Racism weighs on our collective shoulders and diminishes our collective humanity, especially as we become more racially diverse. Racial inequity and poverty are linked to what we find here in our own backyard: the greatest health disparities in the country, life expectancies that differ by a decade just by traveling a few miles. Now, poverty is hard enough as it is, but we heap hardship on poverty by increasing toxic exposures, making it harder to access healthy resources, blocking paths that would lead someone out of poverty. We add social isolation and racism to poverty. We denigrate and humiliate those in poverty, sometimes even through our own pity. It's not just poverty that is harmful to health. It is all the ways we behave toward the poor in this country. In another country, the same kind of poverty would not mean the same lack of access to health care. The same kind of poverty would not mean the same lack of access to a good public education, lack of other public resources, or such limited opportunities. The way people are treated when they are impoverished matters above and beyond their state of poverty. This is a lesson that the families coming to the clinic have been teaching us at Odessa Brown Clinic for a long time. Our clinic is kind of a tale of two clinics. In fact, our community is a tale of two communities. The staff I work next to, they manage to take care of severe and pervasive chronic diseases. We're inundated by inequitably discouraging data about our community's hardships and woes. But in the midst of heavy health burdens, the families we serve are a source of inspiration and renewal. Families teach us every day about culture, about celebration, about resilience and joy and well-being. Families find dignity and dignifying resources and services thanks to organizations represented by many of you in this room today. Families claim victories, big and small, that bring them closer to sustainability. I see children's eyes shine. They shine bright with the light of the possible, the courage to try, the deep desire to learn and grow. And so I ask these families, I ask these parents about their resilience, what makes them so strong, and I get interesting answers. One key strategy they share with me is to pick out environs where they are treated with respect. If they have a choice, they choose to seek support from sources that instill a sense of dignity. This soul-feeding experience fuels their sense of self-efficacy. They are basically saying, if you believe in me, if you demonstrate faith in me, I will succeed. And I don't just mean being nice to someone. I don't just mean thinking good thoughts about them. It pragmatically means investing in them and removing barriers because you believe they are a valuable part of society. Because we are, as Dr. Martin Luther King says, all rich and poor woven into a single garment of destiny. Our poor treatment of the poor makes us all less well, makes all of us sicker. The data on the relationship between higher gaps between rich and poor and higher rates of poor health for all income levels is compellingly clear. Unspinning the spirals of poverty, promoting dignity and undoing racism, practicing philanthropy that invests in, doesn't just do for, and that inspires resilience. That all adds up to complexity, and it's a complex idea much further than just basic anti-poverty efforts. But the complexity is worthwhile because the effort is so worthy. What we do for kids now, especially for kids of less means, ripples forward. And make no mistake about it, what we don't do for kids today ripples forward too. No strong, successful society can measure its individual members' happiness or fortune by the contrasting unhappiness or misfortune of another member. That kind of zero-sum thinking makes all of us unhealthy. We don't have time for false metaphors today about bootstraps or rising tides. We don't have time for those. We're on a path of mutual destiny, and we move in the right direction when every member of society cares about every child in our society, not just their own, not just the ones they see and interact with. Every person cares about every child, including and maybe especially the kids they may never see. The Children's Alliance is a champion for all kids. The Children's Alliance is the convener, the collaborator, the community builder, the inspiring conscience behind moving us from idea to action. And so I ask you, how will we, each of us, rise to the challenge of improving our society? I think the Children's Alliance says to us that this challenge is not a burden. It is a humbling and inspiring honor to unspin hurtful spirals, to build paths to opportunity, to create thriving communities, and to seek out the wise investments that instill dignity and capability. Thank you.